So now that we've got our clients, obviously we're going to be looking in a posterior view of the back of the shoulder here. So this is more about what's happening at the scapula. So the scapula really can sometimes give us a really good indication of what's actually happening at the rotator cuff. We've got so many different muscles actually just attaching onto the scapula itself. So there are a lot of length and tension relationships on the scapula. So one of the first things that we want to do visually, we'd want to see with the scap is whether or not there is actually any lifting or moving away of the scapula onto the rib cage itself. And that gives us a bit of a clue that there may be some imbalances in and around those muscles that attach to the scap. You'll see here that I've marked actually the medial border of the scapula. And the reason we're doing that is because I want to see what sort of function the scap has. Now for Dan, obviously this being the medial border here, we've got the inferior angle here, and then obviously the superior angle up there. We're going to get Dan to try and bring the medial border of his scap towards the spine. That's called retraction, okay, like so. Now, the next part of this is whether or not we can see if he can bring the inferior angle down, so that's depression. So why that is so important is because that lets us know that he's got a level of scapular control, and that's really important, right? You just relax there now for us, Dan. For a lot of people who have rotator cuff dysfunction, they will have the inability to retract, and they will probably also have the inability to depress. So obviously we're asking the rhomboids to bring across, and then we're asking the lower traps to depress. So it's a really good indication on whether or not the scap's going to be working well. The other thing that we want to be noticing is when they actually go through range of movement, does the scap upwardly move or does it lift away as well? So these are little cues that give us an idea on whether or not there may be dysfunction in other areas. Also, if there's winging of the scap, for the most part, we've got three muscles that are extraordinarily important in regards to good rotator cuff function, and that is our coracobrachialis, the short head of our biceps, and also the pec minor. The reason why they're so important is because they all attach onto the coracoid process, and if there's any tension on those muscles, then that can definitely disturb some of the movement activation patterns on the scapula and to the shoulder itself. So keep in mind that the scap should be moving, should be nice and glued tightly just to the rib cage, moves up and down in upward movement, and making sure that there's no winging or lifting away from the rib cage itself. So what I'm going to get Dan to do is I'm just going to get him to bring his arm out into a bit of abduction and moving up really slowly if you can. So you'll notice as he's starting to come up, you can start to see the scap starting to move in that upward fashion. Terrific. Nothing looks like it's moving away. Come back down slowly again for us, Dan. So once again, there's the inferior angle. Follow the inferior angle, coming down, down, coming back in. Beautiful. That's fantastic. And that's what we'd be looking for. What would be dysfunctional if we started to see the inferior angle stopping at one position and then just come up into abduction again, and then he would start to recruit his trapezius muscle and he'd lift from his trapezius. So if you're starting to see that, then you know that obviously there's going to be a problem within the rotator cuff area, and particularly to do with the scapular control. Coming back down, Dan. All right, so we've got our medial border. Let's check the retraction. Let's check obviously also the ability for them to depress. So that means activating that lower trap. And another one I get them to do is just to see if they can actually do a shrug as well, because I want to see what sort of control they might have from the trapezius. So if you can just go up into a shrug for us, okay, which means obviously we're using the upper part of our traps and then back down again. And you can see how evenly he does that. That's terrific. So once again, what we're looking for is any differences from one side to the other, or the inability to actually really be able to bring that up into a shrug position. And that's really, really important when we're talking about people with instability, problems in their shoulder. And if we were having problems with instability, then that's obviously where they need to go off and seek practically a very good sports physiotherapist who deals in that instability area. So very, very important. Still doesn't mean that we can't treat them and can't assess them, just definitely means that that needs to be a protocol that needs to be addressed. All right, so that brings us to the end of the posterior assessment. and we're going to look at some special tests.